Assalamualaikum, I am Dr Junaid and I am Senior Registrar in Rawalpindi Medical University. Today I am going to do the motor examination of lower limbs. So, first of all, introduce yourself, take the consent, do the proper exposure. Assalamualaikum, मेरा नाम Dr Junaid है, मैंने आपका मुआयना करना है, इंशाल्लाह दौरान मुआयना आपको तकलीफ नहीं होगी. Okay? Thank you. In motor examination of the lower limbs, first of all, inspect the lower limbs. Look for any scar marks, visible deformity, muscle wasting, and then the loss of bulk, and then any contracture or any other major abnormality, any rash, nodules, discoloration, anything. Then ask the patient to walk. Beta, walk करके दिखा दो, चल के दिखा दो. This will give you an idea. ऐसे बेटे यहाँ, ऐसे इधर आ जाओ, आगे इधर आ जाओ, शाबाश. अब उधर चले जाओ. Very good, चल के. वापस आ जाओ, शाबाश. इधर आ जाओ, ऊपर आ जाओ. This will give you an idea whether is there any stroke, any joint deformity, any dislocation, any arthritis, or any other major abnormality in the gait. Now, when you do the palpation, first of all, look for any tenderness. Then look for temperature. Compare the temperature of both limbs. Then measure the bulk of the muscles. You have to measure the bulk on both sides. Let's say you measure it about 2 finger breadths below the right tibial tuberosity. Then on the other side, you also need to measure it just below the 2 finger breadths, just below the left tibial tuberosity. I mean to say that there should be a same point on both limbs where you have to measure the bulk of the muscles. Off कर दो. After measuring the bulk of the muscle, you need to see the tone of the muscles. Gently place your hands below the muscles of the posterior compartment of the leg, on one hand on the posterior compartment of the leg and one hand on thigh muscles. Then बेटा पेट ये ढीला छोड़ दें, टांग ढीली छोड़ दें, शाबाश, टांग ढीली छोड़ दें. Do these movements to check the tone. You can check the tone at the hip by doing these movements. Then you can check the tone at the knee, tone of the muscles around the knee, and then you can check the tone of the muscles around the ankle by doing these movements. Beta, ढीला छोड़ दो, शाबाश, ढीला छोड़ दो. Whenever there is pair, always compare. Just do the similar type of movements in the left lower limb. ढीला छोड़ दो. Place the hands. Tone of the muscles around the hip joint. Then tone of the muscles around the knee joint. Then tone of the muscles around the ankle joint. ढीला छोड़ दो. Once you have done with the tone, then you need to see the power of the lower limbs. बेटा, दोनों टांगें ऐसे ऊपर उठा लो, दोनों टांगें ऊपर उठा लो. If the patient is able to raise both the legs, the power is 3. Now you will apply gentle resistance over the lower limbs, and you will ask the patient to raise now. बेटा, अब मैंने इनके हाथ रखे हैं, अब जरा टांगें उठा के दिखाओ. So if he is able to raise the legs, despite of your resistance, the power is 5. If he is able to raise the legs himself, but not against the resistance, the power is 4. If he is not able to raise by himself, the power is 2. If he can move the leg sideways, only, the power is 1. And if there is not even a flicker of movements, no movements at all, even not a flicker, the power is 0. So once you have done with the power, the next thing is reflexes. For reflexes, you need to have a hammer and you need to tell the patient what you are going to do with him. बेटा ये एक हैमर है, इससे मैं हल्का सा आपको ऐसे मारूंगा, आपको दर्द नहीं होगा, आपने डरना नहीं, ठीक है? First of all, check the knee reflex. You have to feel the tendon, the patellar tendon. Once you feel the patellar tendon, you have to strike the patellar tendon and you have to look at the quadriceps muscle. If there is a contraction in the quadriceps muscle, it means that the reflex is present. Whenever there is pain, always compare. I have done the same over here. Then gently, I will make the right lower limb in this position, slightly outward and then turn inward. I will flex the right foot slightly and now I will look for the ankle reflex. When I strike for the ankle reflex, I will look at the gastrocnemius muscle for the contraction. Same will be done on the left side. Slightly flex the foot, strike over the ankle and look for the gastrocnemius muscle contraction. The last is plantar reflex. Before doing plantar reflex, tell the patient what you are going to do. बेटा मैं ये चाबी है, हल्की सी चाबी जो है मैं आपके पाँव में फेरूंगा, इससे आपको दर्द नहीं होगा, तकलीफ नहीं होगी. आप बेटा अपने दोनों हाथ ऐसे कर दो. Ask the patient to do reinforcement gently with a key. You have done the plantar reflex. Both the plantars are downgoing. When you are using the key, go from the lateral position and then come to the medial position. The toe will go downwards and there is fanning of the other toes. The greater toe will go downwards and the other toes will have a fanning. Once you have done with the plantar reflex, although you have been given the command of motor examination of the lower limbs, but still you need to do the superficial reflexes. You will expose the abdomen, gently do the, you can see there is a very good contraction in the superficial muscles of the abdomen. This is the superficial reflex. Another reflex is climatic reflex, but usually it's not done just to not make the patient embarrassed. But you should know the way to do it. You have to do a gentle movement at the thigh, and the scrotum will make a contraction. So that will be chemostaltic reflex. So now if you have the time, go for the other relevant examination. You can do the motor examination in the upper limbs along with the apparent cranial nerves if you have time. And if you don't have time, the bell is just ringing, then you can say thank you so much and cover the patient.